The tightness in your chest comes and goes, after the stairs, after a meal, sometimes for no reason at all. You mentioned it at your last appointment. Your doctor checked your blood pressure, said your numbers looked fine, and moved on. But here's what you weren't told. Heart disease doesn't always announce itself. The changes happening inside your arteries right now, they often begin in your 60s. They're usually invisible on a standard checkup. This is about what those changes are, what they mean for you, and what you can actually do about them. The scale of the problem. The Centers for Disease Control and Prevention has been tracking this for over a century. Heart disease has been the leading cause of death in the United States since 1921. In 2023, over 900,000 Americans died from cardiovascular disease. That's 1 in every 3 deaths. 1 person dies every 34 seconds, not every hour, every 34 seconds. In 2022, coronary heart disease, the most common form, killed more than 371,000 people. That's where fatty deposits build up and harden inside your artery walls. Managing heart disease cost this country more than $168 billion between 2021 and 2022. Now here's the number that specifically applies to you. The CDC and the National Center for Health Statistics have the data for 2024. Roughly 15% of Americans aged 65 and older had been diagnosed with coronary heart disease. About 8% had already had a heart attack. Think of a room with 20 people over 65 in it. Statistically, 3 of them have coronary heart disease, and 1 or 2 may not know they've had a heart attack. That last part is exactly what we need to talk about. Before we go further, everything in this video is for informational purposes only. It's not a substitute for your doctor's advice. Your physician knows your history, your medications, your risk factors. Bring these topics to your next appointment. That's what this information is here for. What actually happens to your heart after 60? The National Institute on Aging, part of the National Institutes of Health, is clear about this. The changes that happen to your heart and blood vessels as you age are real. They're measurable, and they directly increase your risk of heart disease. Here's what's happening at a biological level. Your arteries depend on a protein called elastin to stay flexible. Think of it like a rubber band inside your blood vessel walls. It gives them the ability to stretch and recoil with every heartbeat. After 60, your body produces less of it. At the same time, collagen, a stiffer structural protein, deposits in increasing amounts inside those same walls. The result is what scientists call arterial stiffness. That's a progressive hardening of your arteries. It forces your heart to work harder with every single beat, year after year. Arterial stiffness directly raises your systolic blood pressure. That's the top number in your reading, and elevated systolic pressure is one of the most dangerous and most overlooked risk factors in older adults. There's also something happening inside your heart's electrical system. Your heart has a natural pacemaker called the sinoatrial node. After 60, this node can begin to degenerate. When it does, it can trigger irregular heart rhythms. The most common of these is atrial fibrillation. Atrial fibrillation, most people call it AFib, is not a minor nuisance. It's an irregular, often rapid heartbeat in the upper chambers of the heart. It raises your risk of stroke, heart failure, and other serious complications. The National Institutes of Health has supported research on this. Roughly 5 to 9% of people between 60 and 80 have it. By the age of 80, it affects about 1 in 10 people. The troubling part? Many people with atrial fibrillation have no symptoms at all. Aging also changes the structure of your heart muscle. Research published in 2024 found that with age, the heart wall tends to thicken and become more rigid. The heart becomes less able to relax fully between beats. This is called diastolic dysfunction, meaning the lower chambers have trouble filling properly. It's one reason why exertion that felt easy at 50 can leave you breathless at 65. The symptoms that get missed. This is the part your doctor may not have time to explain in a 15-minute appointment. Heart disease in older adults doesn't usually look like the dramatic moment you've seen in movies. It can be subtle, it can mimic normal aging, and in many cases, it can be completely silent. Let's start with something called a silent myocardial infarction, a silent heart attack. According to Cleveland Clinic, A silent heart attack causes the same damage as a regular one, but it happens without the typical warning signs: no crushing chest pain, no pain radiating down the arm. Symptoms, when they occur at all, might be mild jaw discomfort, unusual fatigue, or something that feels like indigestion, or nothing whatsoever. Many people only discover they've had 1 week or months later. An EKG done for an entirely unrelated reason is often how it's found. Then there's heart valve disease. Your heart has 4 valves that open and close with every beat. They keep blood moving in the right direction. When those valves wear down or stiffen with age, blood flow is compromised. Here's what the CDC found, and it's striking. 75% of American adults know little to nothing about heart valve disease. That includes nearly a third of people aged 65 and older. It's significantly underdiagnosed. One specific form is called aortic stenosis, a narrowing of the main valve that carries blood out of the heart. It affects 5% of people over 65, 1 in 20. The symptoms? Often it's fatigue, shortness of breath on mild exertion, occasional dizziness, things that are easy to dismiss as just getting older, things a brief checkup can miss without specific screening. Then there's heart failure. The language matters here. Heart failure does not mean your heart has stopped. It means your heart can no longer pump blood as efficiently as it should. It's working, but it's struggling. According to the CDC, nearly 6.5 million Americans are living with heart failure right now. The death rate has been rising. In 2011, it was just under 19 per 100,000 people. By 2021, it had risen to nearly 26 per 100,000. According to the CDC, nearly 6.5 million Americans are living with heart failure right now. The death rate has been rising. In 2011, it was just under 19 per 100,000 people. By 2021, it had risen to nearly 26 per 100,000. That's a significant change over just 10 years. According to Mayo Clinic cardiologist Dr. Gosia Wamil, coronary artery disease is the main cause of heart failure. The second biggest driver is stiffening of the heart muscle, most often from poorly controlled hypertension or diabetes. Speaking of hypertension, the Framingham Heart Study found that high blood pressure affects more than 50% of Americans over 65. In older Black Americans, that figure approaches 75%. High blood pressure rarely causes symptoms. Physicians have called it the silent killer for decades. That name is still accurate. The connection between your heart and your brain. This doesn't get enough attention in a standard doctor's visit. Some risk factors for heart disease are also linked to your cognitive health, including your risk of developing dementia later in life. The National Institute on Aging is direct about this connection. Some risk factors for heart disease are also linked to your cognitive health, including your risk of developing dementia later in life. The same arterial stiffness that strains your heart also reduces blood flow to your brain. The same uncontrolled blood pressure that damages your heart muscle damages the delicate vessels that feed your brain. This isn't a coincidence. It's the same vascular system. Protecting one protects the other. The National Institute on Aging notes this specifically. Controlling your blood pressure may help delay or lower your risk of cognitive decline. Caring for your cardiovascular health after 60 is also, in very direct terms, caring for your brain. What medicine knows now, the good news, and there is significant good news, is that the science has advanced considerably. The American Heart Association released a framework in 2022 called Life's Essential 8. It updated an earlier checklist and added one component that had been missing: sleep health. The 8 components are diet, physical activity, nicotine exposure, sleep, body weight, blood lipids, blood glucose, and blood pressure. Research on this framework found something worth pausing on. People who scored highest on Life's Essential 8 metrics had a 64% lower cardiovascular death rate compared to those who scored lowest, 64%. That's not a small difference. On diet, the dietary approaches to stop hypertension diet, called the DASH diet, was named the best heart-healthy diet in 2025. U.S. News & World Report gave it that ranking, supported by the National Heart, Lung, and Blood Institute. The The DASH diet emphasizes fruits, vegetables, whole grains, lean protein, and reduced sodium. It's not a trend, it's decades of evidence. On physical activity, the American Heart Association recommends at least 2.5 hours of moderate activity per week. That's 30 minutes, 5 days a week. Brisk walking counts, gardening counts. On blood pressure, an NIH-funded trial changed how many cardiologists think about blood pressure in older adults. It's called the Systolic Blood Pressure Intervention Trial. Most people know it as SPRINT. The trial found that lowering systolic blood pressure below 120 significantly reduced cardiovascular risk in adults aged 50 and older. On medication, there are newer options that many patients over 60 simply don't know exist. According to Mayo Clinic, a class of drugs called SGLT2 inhibitors has shown meaningful benefits in managing heart failure. These medications were originally developed to lower blood sugar in people with diabetes. Many people with heart failure aren't being offered them simply because they haven't asked. On tobacco, Mayo Clinic reports this. 1 year after quitting smoking, your heart disease risk drops to roughly half that of a person who still smokes. Half in 1 year. Before you change your medications, your diet, or your exercise routine, talk to your doctor first. Your physician knows your full history. What works well for one person can be wrong for another. Bring this information to that conversation. What you can do starting today, let's bring this home. The American Heart Association puts it plainly, more than 80% of cardiovascular events may be preventable through healthy lifestyle and managing known risk factors. That includes heart attacks, strokes, and heart failure. 80%. Take note of this figure, 80%. The most powerful thing you can do for your heart after 60 isn't waiting for symptoms. It's being proactive when there are none. Get your blood pressure and cholesterol checked regularly, even when you feel completely fine. Ask your doctor specifically about heart valve screening. Ask about atrial fibrillation, especially if you've had unexplained fatigue, breathlessness, or a fluttering feeling in your chest. Move your body for 30 minutes most days. Work on reducing sodium in your diet, and prioritize sleep. The American Heart Association added it to the Life's Essential 8 framework for a reason. If you smoke, 1 year after quitting, your heart disease risk falls by half. The changes happening in your body after 60 are real, they're measurable, but they're not beyond your influence. What you now know, heart disease after 60 isn't inevitable. It's common, extraordinarily common, but the evidence all points the same direction. The people who do best know what's happening inside their bodies. They ask the right questions at their appointments, and they act on the answers while there's still time. You now have more of those questions. Take them to your doctor. Thank you for watching this presentation. Take care.